This is Dr. Antolak from the General Dentist. We're in Shelby Township. Our phone number is 586-247-3500. And I wanted just to go over some options for tooth replacement. So what happens when you have a tooth removed is this is a model, and we're going to say that you removed one of this teeth here. Well, actually the first thing that starts to happen is that your bone itself starts to shrink down. The diameter and the thickness of the bone starts shrinking down over a period of time. So what do we do to combat that? And you know, the other thing too is that what people have to deal with so many times when they do have a tooth that's missing is then you try chewing and you start getting food caught inside of where that tooth was. It irritates the gums, and then the teeth adjacent to it all start trying to shift into that space. As it shifts in that space, it makes open contacts in there, and then you start getting food in there and you get cavities, and it's one thing after another. So the best thing to do is to be really proactive with a tooth that when you need to have some teeth replaced. And so what I'm going to do is a very quick overview of that process. I'm going to start with the most conservative thing first, and that's a dental implant. A dental implant is where that tooth is removed. That implant goes right into that jawbone like this. We give it about 3 months or so to 4 months for that to heal inside that bone. It'll actually grow in that bone, and then it'll be flush with the bone like this. Then after that period of time, we put what's called an abutment on, and then we can replace that missing tooth with the crown. Okay, so that would be the most conservative way first. If that is something that will not work, or for some reason, then we do what's more of a traditional method. It's called a fixed bridge. Now this is much smaller example, but a fixed bridge is where if you have a missing tooth here, then we have to repair the sides both adjacent to that, and then we connect it with what's called a bridge. Just like the Ambassador or the Mackinac Bridge, you've got land here, you got land here, and you've got the river between it. And so, and what that is that then helps to replace it. It's fixed, it gets cemented in place, and it should not come out. The only issue with that is then you have to clean underneath that, and these are all connected together. So it makes cleaning a little bit more challenging, but it's a good option. It's what we used to do much more in the past before dental implants came along. The next few methods are using more of a removable process. So this is called a partial denture. A partial denture is where if you have a number of missing teeth and you have a few natural teeth that are in good shape, this is removable. So you have to, it goes in, it snaps in place, and it holds onto the teeth, the adjacent teeth, so they have to be in good shape for that. And the issue, the negative consequence of this is that you can get food caught underneath it, and then it moves around a bit, and it does attach to the teeth, but it's the best way of replacing a number of teeth, and probably the most cost-effective way when you just have some missing teeth doing that, but it is removable. Of course, if you have to remove more teeth in your mouth, then you have to have what's called a denture. And this is a denture. Basically, we take all the teeth out. The gums help to support it. The challenge of a denture, as we know, is that it can cause, when people have embarrassment, if they smile, if they laugh for some time and it's loose, it'll pop down. It's very embarrassing. Your ability to chew food is probably limited to maybe 30 to 40% of the biting force as if you had your natural tooth. So you have to be limited on your food that you eat. On the upper, the only one that keeps it in place is the suction that you have within the ridge itself. And so you put it in, but they move around. You have to really eat softer foods with it. On the lower one, it's just the position of your tongue and your lip that keeps that denture in place, and it moves around. It's very uncomfortable. So I usually, these days, we try to not eliminate. If we have to use these, we'll do it. But there's a number of different options. The next step up from a full denture would be something called an implant retained implant. So these are implants placed, like I just described, for one tooth, but this has implants in here, and these will actually snap down. It's inside the denture itself, and they snap down, and they help hold that in place, but it is removable at that point. One disadvantage is that usually you have to have a palate, or the roof of the mouth is covered. When that roof of the mouth is covered with a full denture or this type of thing, is that your ability to chew food is there, but you can't taste it as well. Our taste process happens from the thermal, being able to feel food if it's cold or hot. With an insulator like this, it definitely affects your ability to enjoy food because of the fact that it is covering the roof of the mouth, the palate. Now the best way of replacing teeth, if we can do that, is to do what's called a hybrid. It's a hybrid denture. that is made. These are actually screwed down into the implants themselves. You can see implants sitting right in here, okay? And the benefit of this is that we can take a person who's got teeth that are really, they're not happy with them. Within a few months of time, we can actually take the teeth out, put the implants in, and give them something that's permanently fixed in their mouth, which is great thing about this is that it's a permanent solution. You don't have to worry about going to the dentist and always have something happen and something happen and something happen again, but it definitely helps. You do have to maintain it well, but these are some of the different options that you can have. All the things do require maintenance, that, you know, so we can help improve the situation that you have. But so these are all really great opportunities and great ways to replacing your teeth. If there's any questions, 586-247-3500 is our phone number, and our website's thegentledentist.com. Thank you and have a blessed day.